Hi everyone, my name is Dawson and I own a marketing company that helps dentists increase their Invisalign and implant production by $20,000 to $50,000 in the next 90 days. If that's something you're interested in, feel free to book a call at the link below. Without further ado, let's jump right into the video. In today's video, we're looking at implant production. So we're gonna show behind the scenes on how we get dentists $20,000 to $50,000 in 90 days in implant production value. So without further ado, let's jump right into the system. Today, we're going over implant production. We're going to show our entire system for how we get dentists $20,000 to $50,000 in revenue for our 90-day profit program. So we're going to dive into the entire system. We're going to look at, break down the different parts, look at some of the mindsets behind it, maybe the most common problems that come up during it. This is going to be an extensive video, so feel free to sit back, relax, and take some notes. A little background on me is I have a marketing company that helps dentists across the US grow. We worked with many types of practices over the years. We worked with dentists that own 6+ practices, want to get a new one every couple months, and then eventually retire on a private island by selling those practices to a private equity fund. We also have dentists that just want 1 or 2 practices, but maximize that to a couple $1 million in revenue per year. So no matter where you're at in your journey right now, this information can be useful to you. The reason I want to make this video is just give dentists some context before they schedule a call with me. I just give you a framework for our system and if it's going to suit your needs and is going to be a good fit for your situation. So a few caveats before we jump into the system. Now, obviously, if you're going to get a full arch case needing full mouth restoration, then it's going to be anywhere from, depending on your numbers, $30,000 to $90,000 a case. Really depends on the work needing to be done. So that would do it for the $20,000 to $50,000 range there. But if we're assuming that most of these candidates that come in just need a single implant, average production value for that, let's say, is $5,000. So if we bring in 4 cases over a 90-day period, that's $20,000. Obviously, if we bring in 10, that's going to be $50,000. That's where we get those numbers. Now, the reason why this works is positioning. We're going to get into that a little bit later in this video, but just wanted to mention that up front. The way that you position yourself online is critical. We're going to talk very much in detail about how to set that up yourself. Now, hitting these numbers for any office is going to be very realistic. Again, if you're interested in seeing the system, learning more about it, feel free to schedule that call below. All right, let's look at an overview of the system. All right, so here's the system from a bird's eye view. So first we have Facebook ads. We're sending traffic to a messenger bot. From the messenger bot, that's where we confirm and really find out if it's a good lead. Get the lead, we get their information, and that's when we schedule them for a consultation. Very simple system. The reason we're able to generate great results with this strategy in particular is because of this feature here, this part. With the messenger bot, we're able to get lower cost per impressions on Facebook because more people are interacting with the ad. Facebook loves when you have more people engaging, especially with an advertisement. So they're naturally going to give you lower cost per impressions, hence lowering the cost for leads. Another reason why this works so well is this Facebook ad portion. You can make any changes on the front end of the funnel. It's going to dramatically impact the results you get throughout or at the very end of the funnel. Obviously, if you make the pipe at the very front bigger, you're going to get more flow in initially, hence increasing your results. The reason we get better results on the front end is all due to positioning. This is what I mentioned before. So these ads are going to be effective because they really resonate with the patient. They really resonate with someone in the implant buying process. And the reason being is because we give them valuable information about what to look for when buying an implant that not only builds that trust, but also just allows them to benefit from the ad, hence engaging with it and lowering our cost of ad spend. Our Facebook ads are also very personal, so we're able to get better engagement, really connect with the patient, as I was saying before. One thing I want to mention about the messenger bot process is this is really where we figure out if someone's going to be a good fit for implant treatment or not. We ask qualifying questions related to what if they have a source of income, what their credit score is, information that would allow us to find out if this is going to be a good lead or not. So the leads that we get on the back end, they're not 3-star leads, meaning name, email, and phone number. They're actually 5-star leads because we have information. We know that they're a good fit for implant treatment because of their credit score, and we know the reason why they're coming in to get it in the first place. And then in this process of bringing the lead into an appointment, getting them to come into the consult, this is where we set expectations. This is where we exchange information regarding insurance. This is really where we start to build that connection over the phone with the patient so that when they're in the office, when you guys present the case to them, it's not a matter of, let me shop you down the street. It's a matter of, okay, I already know, like, and trust Dr. So-and-so as a person and as a dentist. We find that cases taken more seriously because we've done so much work on the front end to establish that relationship. Now, a great thing about this process is we can actually filter out anyone that you know right off the bat would not be a good fit for the office. So if someone has Medicare, Medicaid, and you don't accept that for implant treatment, then we can have a question that actually segments people out of the process here so we don't spend any time with leads. We don't waste our time. We don't waste the other person's time in that process. All right, so let's take a look at each of these steps in detail. First, we'll start with Facebook ads. All right, everyone, welcome to Facebook. This is going to be an in-depth dive on how to set up one of these campaigns. Some of you may not be familiar with this screen. Maybe some of you have boosted a post before. This is the more sophisticated side of running Facebook ads because we are in Business Manager. So real quick, just the layout of Facebook ads. We have campaigns, ad sets, and then ads. So for the parts, we have the campaigns. This is where we set the objective, really tell Facebook what we're trying to do. Ad sets, this is where we set the targeting. We find out, hey, Facebook, I want you to find people in this mile radius. I want them to be between these ages, this gender, yada, yada, yada. And then for ads, this is where the rubber meets the road and we submit the actual picture or the video that we're going to be showing in our advertisement. All right, let's create a campaign from scratch and I'll show you the process. So firstly, we have a couple different options here. So as you can see, they're kind of broken down into 3 different categories: awareness, a consideration, and then conversion. So awareness, you're telling Facebook, I want you to show this ad to as many people as possible. Whereas conversion is, I want you to find people that have a history of making a decision, either submitting info or purchasing on Facebook. So this is very targeted. This is show it to as many people as possible. And then this is somewhere in the middle. For the sake of our campaign, because we're running traffic to a messenger bot, we're going to choose traffic as our objective. Alrighty, so here's some more information for setting up the campaign. We can create a name. The only other thing we can do here that would be beneficial is really setting a campaign spending limit. We could do it by campaign. We could also do it at the ad account level, whatever's most comfortable, whatever is better for you. If you have multiple services you're marketing for, set them up different campaigns. This could be useful here. Other than that, there's not too much we need to do on this screen, so we can go ahead and click next. So this brings us to the ad set portion of Facebook ads. This is why people advertise on Facebook. It's all because of this section right here, audience. Facebook has an incredible amount of data, an incredible amount of information on people's online behavior as well as who they are. So for our sake, because we're doing local-based marketing, we're only going to set a mile radius around the practice, and then we're going to pick the demographic that's most likely to come in for implants. I won't go too into detail in this video because we have other videos that go really into depth on this. For our sake, this is where you would put in the address of your office. We would set a mile radius anywhere from 1 to 10 miles, depending on how populated your area is. One thing to keep in mind as you're kind of messing around with how far you want to make that radius, pay attention over here to this estimated audience size. You want this number to be anywhere from 80,000 to 150,000 people. There's no hard and fast rule. The only thing to keep in mind is supply and demand. So the less people that you give Facebook to show your advertisement to, then the more expensive it is going to be for the cost per impression. I've heard different people say different things, but that's kind of the common sense we can use there to deduce that. Another thing is age. So on average, we do anywhere from the ages of 30 to 60. This obviously depends on your market and your demographic. You would know the best people to advertise to in your situation. Just one key thing is women make 90% of all dental-based decisions. Keep that in mind. Obviously with implants, both men and women need implants, but just keep that in mind as you're running ads. Detail targeting, this is where we can select any interests that someone may have that could be connected to getting an implant. For our sake, we're not going to use this because we only have 100,000 people, 150,000 people in that audience. That's pretty limited anyway. We don't want to make that any smaller, hence increasing the cost per 1,000 impressions. So we're going to leave this blank. Placements, same thing. We're going to leave this to automatic. If we pick manual placements, we're kind of shortening the amount of options that we give Facebook, hence making it smaller, hence raising our cost per impression. So we want to leave this at automatic for that reason. And we don't have to get too fancy with the bid control. That's for very advanced. And especially, again, because our audience size is so small, we're not going to be messing with that. All right, now it is time to go to the ad. Alrighty, so this is where you would select your Facebook page, your Instagram account. If you don't have an Instagram account, that's totally fine. It will have another option here. Basically creates a small little landing page for you. Very simple. You don't need an Instagram account to advertise on Instagram, although it is recommended. This is where you would put in your image or your video. And let me say, this is the most important part of this entire process. As long as you're advertising in the correct location, you have a decent sized audience, this is the most important part. If you don't have good creative, then you will not do well on Facebook. Your creative is just your video or your picture. It's important to keep it personal. Don't have any type of stock photos. Your ad is not supposed to look like an ad, or else people will just automatically scroll past it. It's very competitive on Facebook in terms of people's attention. Your ad is going to be next to someone's engagement pictures, a cute picture of someone's dog. You really want to be aware of how your ad can be eye-catching. For those of you who want to go really into depth, there is a great book by Brendan Kane. I talk about him all the time on this channel because it's so critical in our day and age. He was Taylor Swift's social media manager. He worked at Paramount Pictures, worked at MTV doing the marketing. And basically his whole premise of this book, called Hook Point, is you really have 3 seconds to get someone's attention. Next time you're in public, next time you're with your loved ones, pay attention to how fast they're scrolling on their phones. They just did a study. The average person scrolls 300 feet of content a day. So you really need to have something that's going to get someone's attention while they're scrolling. Brendan Kane refers to this as a hook point, something that's going to hook them in and buy you a couple more seconds for them to really pay attention to your ad. They did a study on people's eye movements as they're on Facebook. So the first thing they look at, obviously, is a picture. They look at the headline, and then they start reading the copy. So make sure to prioritize your efforts in that order. Pay the most attention to the video or the picture you're going to post, then the headline, and then the copy. Now let's go back to the hook point. Hook points that are working right now in dental marketing are going to be something that is patient focused. It's important. One of my favorite quotes is, it's important to meet your patient's mind before you meet your patient's mouth. So before we can even think about doing any type of treatment on them, we have to be able to connect with them and really figure out what they need. One of the best things to run on Facebook right now is any type of content related to the implant process, meaning any type of educational content that's going to educate someone in that buying process. One of the best things you can do is film a video called the top 5 or 10 questions to ask your implant provider. Having videos that are going to be educational are going to really hook the viewer in and be able to not only provide value, but also really present yourself as the authority figure. Speaking of authority, Dr. Robert Cialdini wrote a book called Persuasion. Highly recommend it. It is one of the best business books in the past 30, 40 years. And in it, he talks about something called the authority bias. Now, authority bias is naturally something you're going to have as a dentist just by even having your white coat on as you're presenting your video, as you're presenting the information. But also, the important thing to do is as you're demonstrating this knowledge, it's going to create that authority bias within the patient's mind. So that's going to help you establish that connection with them. Another thing he talks about in his book is called liking bias. Now, just by you talking, just by you being yourself, showing a little bit of personality, people are going to automatically kind of get a sense for who you are as a person, create that connection with you, and start to like you before they even come into the practice. This is important, especially with case acceptance. I know if some of you are struggling with having issues with bringing someone in for an ad and they don't really know you, they don't really trust you. So it's kind of an awkward conversation when you bring up the case. They have to think about it. They have a lot of objections. That's really just because they don't know you. They don't really trust you. So having videos where they can really get a feel for who you are, you'll find you get less objections from those patients when they're actually in the chair. Another psychological principle you're also implementing here is reciprocity. So just by you giving away valuable information about what to look for in the implant process, people have that need to give back to you. And even if they aren't in the implant process, the way that comes through is by liking the post, even sharing it, or even commenting someone's name that is in that process. Again, like I said before, this is where most dentists go wrong. This is the placement aspect of this entire thing. If you get this wrong, it's going to mess up everything else. And with your ads, it's important to mention that the reason someone gets implants isn't for the implants themselves, it's for what they get from it. What's the benefit of having implants? So keep that in mind as you're creating your ad as well. This is really as secret gets. That whole past 1 or 2 minutes of me talking about this aspect, that's as secret as it gets. So feel free to go back, listen to that again, and really take notes, because that's the number one reason why I see dentists fail on Facebook. That's why a lot of them get burned or have a bad experience with Facebook. It's really for that reason. So just remember when you're in this process to be thinking of potential questions that a implant candidate is asking. Good questions would be, do I need a CT scan in order to get an implant? Should I fly overseas to get an implant? Answering those questions in video format is going to be the thing that's working right now for dental implant marketing. All right, so now that we have that taken care of, let's look at the Messenger chatbot. All right, so we just went over the Facebook ads portion. Now we're gonna look at the Messenger bot. So don't let this intimidate you. This is the ManyChat flow for the implant Messenger bot. So there are several questions that we ask the potential candidate going through, and each of their responses is recorded and placed within a spreadsheet so we know what they responded. So over here, very, very simple. Then try the calculator and then ask questions about, is this for your significant others? Is this for yourself? Why are you looking to change your smile? And really just asking questions to figure out, okay, why is this person coming in? Are they financially qualified? Do they have a ballpark for how expensive it's going to be? Are they okay with the monthly as well as a down payment that our office would handle if they could afford this treatment? So all this information is going to be placed here. Again, biggest reason is really just to scale how serious the lead is, as well as if they're a good fit. So once we find out they're a good fit, that's when we ask for their name, their phone number, contact information in order to schedule them for a consult. So very simple. Again, don't let this be too intimidating. Just asking basic questions to really see if they're a good fit. One more thing I want to mention is, depending on your situation, this can be better than sending people to your landing page or your website. The reason being is because they stay on Facebook. They don't have to wait for the page to load. They don't have to switch apps, which can be inconvenient. This all happens within the Facebook ecosystem. So as soon as they click, I'm interested in the ad or learn more, that's when this first message would be sent to them, and it would pop up on their screen. So that's how we're able to go about that process. Another key thing here is we can really find out where people drop out. So they're submitting their info up to here, and we find most people stop at this question. That's when we can go in and start to even adjust this messenger bot so that we can get more people qualified and really see if they're a good fit. Another important thing to do is watch out for the questions that people are asking in the chatbot when they just submit it, and then stay on top of those conversations to really follow up with them. Alrighty, so we have someone that has found our Facebook ad. They're interested, they click through it, they start our messenger chatbot sequence, they go through our entire process, we found out they're a good fit. So that's when they submit their information for a lead. Now I'm going to show you the lead process and what it looks like managing them. All right, so this is an example of a dashboard we would have for a client. Now this is just, we have some dummy leads in here, so just excuse the numbers. But this is where we would have the amount of opportunities show up, how many leads we have in the pipeline, a total pipeline value. Again, we can adjust this based on what treatment they need. If it's a single implant, multiple, maybe even a half or full arch, we can adjust that there. And this is great to see how many leads are in what stage. So people that just opted in, people that we have scheduled for an appointment, and really gets you a better picture of where are my bottlenecks and how can we improve the system overall. And we also have that in our pie chart as well. Now let's look at how we manage the leads. Alrighty, so on this screen, we're able to find out what leads are in what stage of the process. For every lead that comes in, they're going to go directly into this opt-in column. From there, that's where we train your team to follow up with them, to set that appointment, and then really find out if they started treatment or did not start treatment. So the main thing with this is really just seeing, hey, I have this many people in this column, this many people scheduled appointments, this many people started treatment. So this is a great visual to really get an idea of what stage everyone is at. Another feature I want to give light to is we can actually communicate with, let's say, Amy right over this platform. So we can send her texts. Now we don't have a number set up in this dummy account. That's why you see an error here, but we can see all the conversation that we have had with Amy. So when your front desk goes to follow up with Amy, they can see all this conversation. If she asked a specific question that we can answer, all that is going to be right here. Another great thing is we can actually call directly from this platform, and it records the call. So if anyone's using CallRail to figure out what your team is saying over the phone to potentially coach them, we can actually coach them right over this system. So if they call through this app, it records it, and we can listen to that conversation with the patient, go over any coaching tips that can make them better next time, and really find out if we're running at a good pace. Now I'm going to go over some tips on how to call these leads. Now this is critical. This can make or break the entire process here. That first connection with the lead is going to be the most important. When you call the lead for the first time, make sure to call them within an hour of them submitting their info. Obviously, if it's outside of business hours, that is another story, but the sooner you can get a hold of this contact, the better. It's important to, before you pick up the phone, remind your front desk to always be smiling. Smiling automatically changes your tone. Make sure they're not doing anything else on the computer or trying to talk with someone else as they're on the phone. Have one track mind, be smiling, not chewing any gum, just basic phone etiquette when they call the lead in order to get them to establish that connection. Some other tips are, the most important thing is to really schedule that appointment. Any questions that they have related to cost, we really can't give them an accurate price. We don't know if they need a bone graft. We don't know what kind of work needs to be done. So the best option is always to get them to come in for that appointment and be able to answer all those questions through there. Another tip is to have your next available appointment time in your head, maybe even off to the side as you're having this conversation, just to limit any back and forth with the potential patient. And once we're able to get them scheduled, now we're going to call them as a reminder for their appointment, and then that's when they'll come in for their consult. So let's look at the consult aspect in order to really figure out how we can wrap this up. So now that we got that lead scheduled, the next important thing to do is to bring them in for their appointment. The best thing that we can do is to call to confirm that lead, to make sure that we reduce our no-show rates, and as well as to just build that relationship with the patient. The best way to do this is have your front desk call them and really tell the lead, hey, this is, let's say the front desk person's name is Trish, and right now we're calling Amy. So Trish would say, hi Amy, for your appointment tomorrow, make sure to ask for me. I'm really looking forward to meeting you. I want to make you feel as welcome as possible. Any type of connection that we can make like that, that's personal, that's genuine, is going to go a long way for Amy. We're finding that this actually reduces no-show rates just by really changing the dynamic from Amy canceling on implant dentist that doesn't really care about her to canceling on Trish, the nice front desk lady. So that's a key there. Really make sure to build that relationship with the patient during this process. All right, now that the lead has come in for their appointment, we got them on the calendar, let's look at the consult. And just as a reminder, we finished the Facebook ad portion. They liked the ad, they went through the messenger bot, became a lead. We followed up with them, we confirmed their appointment. Now it is time for their consult. So let's look at some of the details there. The best thing I can say for the consult is to look at success. Clear choice centers around the US have had the most success, in my opinion, with this. The reason being they've been in business for, I think, since 2006, and they have dealt with over 90,000 implant patients. That's not leads, that's not the production value, that's 90,000 different implant cases that have actually gotten treatment from them. That is a giant number. Anytime someone has done that many times, they have a proven system down. So let's look at some tips from the Clear Choice appointment. One thing that they do great is have a personal concierge. They have someone follow them around to every different stage of the appointment to really establish that personal side of it. Once they listen to why the patient is coming in the first place, that's when they bring them to the actual implant dentist and talk more about, what does it look like to get this treatment done. The biggest thing that they do is they make the plan custom tailored. Can't mention that enough. That's obviously what's going to happen for any case, but the more you're able to express this plan is personalized, this plan is tailored, it's going to go further than, hey, this is our boilerplate procedure for anyone in your situation. Anytime you can make it personal, make it tailored, it's going to go further. A great quote by a Clear Choice dentist in Washington, I think I mentioned this earlier in the video, is meet your patient's mind before you meet your patient's mouth. That was by Dr. L. Abrashi. If you don't know why they're coming in for their consultation, if you don't figure that out, really get to the bottom of why they want this procedure done now, why they didn't do this a year ago, why they're not going to wait. Finding out that reason why is going to be the difference between you getting that case by you doing the operation yourself versus them going down the street and having Dr. Bob do it. All right, so that is the consult. Let me talk about some of the long-term keys to success. The biggest thing here is make sure there is clear communication between the marketers as well as the staff. The biggest thing I see breakdown is this process here is, we can bring you 100 leads, but if there is no one following up with them, if there's no one to bridge this gap, then ultimately you're going to get burned. It's not going to work out well. So make sure there is clear communication between the front desk and the marketing company. We create a very strong connection with your front desk. We train them personally. We get to know them as people. Anything that we can do to really make sure we're on the same page for that process. That's why we're able to generate the results for our clients. Another reason why this works so well is the concept of the value ladder. Now, the value ladder was coined by Russell Brunson. He's a famous marketer. Essentially, what he's saying is you kind of walk people up different products or services that are increasing in value. For a dental office, we get them in on maybe a free teeth whitening. We get them into just routine cleanings. And then that's when we get them on higher ticket treatment like Invisalign or implants. If you are able to get them initially on the higher ticket item, it's much easier to walk them down the value ladder, meaning some of those implant patients that come and actually get their procedure done with you are going to be those lifelong patients because they have so much trust built with you. Another key thing is these implant patients will also refer their friends and family. So cost per acquisition per lead is dramatically decreased for every person that they recommend. So if we bring in one person, cost per acquisition is $400, just throwing out a number. If they are able to refer their brother or their sister that needs the same operation, that's going to dramatically decrease their cost per acquisition. Another key to long-term success is refreshing the creatives, really making sure that this process on the front end is working well. All right, let's go over some common pitfalls for this system. This is where I see most people go wrong. Number one is going to be the handoff between the lead and the consult. Make sure that you're following up with leads on time. Make sure someone is calling them multiple times to get them on the calendar. If this part is off, it will not produce an ROI for your practice. Now, this could be the result of poor communication, maybe wrong expectations set by the marketing company. So we go above and beyond to make sure that everyone is on the same page. Everyone knows what they need to be doing. They have proper training. We have check-in calls. And that's why we really make sure that this process is tight and that we don't have any issues. Another common pitfall I see is the lottery-based mentality. Now, this goes for almost anything. If you're kind of crossing your fingers, kind of hoping this will work, not really committed to the process, that is automatically right off the bat a sign of this not working out. Anytime you treat something like a slot machine, whether it be Google ads, Facebook ads, mailers, whatever you want, anytime you have that mentality of, let me just kind of throw money at it, kind of see if it works, and you're not committed to learning it, not committed to mastering it, you're not going to get the results that you want. One analogy I like to make in this situation is comparing art, for example. People nowadays, when they paint, have access to all the resources, access to all the painting tools they could ever need, have all the training, especially with YouTube. But if you think about Leonardo da Vinci and grew up arguably in poverty, didn't have access to that much in terms of compared to what we have today, but he mastered painting. He mastered the principles, and that's why we still remember him today. Compare that with anyone that just kind of tries, has more resources than him, but didn't do as well. That's kind of the difference there, especially with a system like this. If you don't master the principles of marketing, if you don't master Facebook ads, the actual canvas, the actual expression of it, then you're not going to get good results. Another common pitfall I see is not tracking any data during this process, not identifying any bottlenecks. Sometimes it can kind of get lost if you have no sense of numbers in the situation. If you don't know your cost per lead, cost per booked appointment, then you're going to be acting based on emotions. You're not going to be proactive and doing what you need to do in order to get the results. Another pitfall that I see, and I think I mentioned before, is poor creative. If creatives aren't refreshed, if they're not engaging, then ultimately people won't go down the funnel and they won't be able to book that appointment. Alrighty, I hope this video was useful. Feel free to ask me any questions in the comment section below. If you want to learn more about the system and how we can implement this for your practice, feel free to book a call at the link below. If you got some value out of the video, feel free to like it. Consider joining the Consulting with Dawson family by subscribing. And until next time, I will talk to you later.